Hello, everybody. I'm Dr. Claudia Onrick, and one of my areas of specialty is family wellness, how to grow family practices. And I have over 35 years of family practice, and I'm also known as the co editor of the textbook Pediatric Chiropractic. It's in the third edition. If you have the white cover one, that is lovely, but it's missing 8 new amazing chapters, everything with breastfeeding, tongue tie, extremity adjusting, the safety of adjusting children, and 3 extra techniques in there. So if you don't have not invested in the blue version of it, please do. It's just a great reference point for you as a family wellness chiropractor, a book to go back to learn more and to get all that information. I'm so excited today about talking about drugging of children 4 on psychostimulants. And right now we're going to go to the slides, but I want to thank number one, ChiroSecure, because they've done such an amazing job. They just care about our profession and they're here to support you. So again, if you're needing to actively get the most amazing malpractice, go to ChiroSecure. So hello everybody. As we were mentioning earlier about the drugging of children part 4, I'm going to get a little bit of psychostimulants. And what's really amazing is that through the field of psychiatry, American Academy of Pediatrics, even to some degree the FDA, we just know that these drugs are not good for the pediatric population. But the problem is with these kiddos is that their parents are so frustrated. The school system is so frustrated that is at the end result, what happens is these kids get on drugs through, again, sometimes the referrals from the pediatric area, from counseling into school, and the frustration of the combination that a lot of times parents don't have time, like teachers, they don't have time to work with kids. And so the end result is more and more children are being using these psychostimulants. And it started off with products like maybe Prozac. It started off with products like Ritalin. I'd like to break this all down and share with you how scary they are. What's happening is in the pediatric population, and we don't have all the numbers out yet, but in the last decade plus, we've had a massive increase of the psychostimulants. And since COVID, and again, those stats are not out yet, but the American Academy of Pediatrics noticed that a high rise of depression, anxiety of children. So if that was on the rise, what's the first thing they're going to go to? They're going to go to the drug world. So a lot of these side effects I'm going to show you today are related to what these kids, even what we call the COVID kids, what they're being exposed to. The problem is that when these drugs are being recommended out, prescribed out for them, our problem is that if a child really does have an emotional dysfunction going on, and maybe sometimes it's only really a small event, our problem is that the pediatrician is making the recommendation of the drug. Where Dr. Bregan, he's a psychiatrist, one of my favorite people on the planet. I really like Dr. Bregan's approach is that let's get psychotherapy, let's get some kind of emotional therapy, even spiritual therapy would be better than putting children on drugs. But the result is that they are getting, unfortunately, children being exposed to drugs. And once you start them on there, it's a downward spiral for these kids. What's going on with antidepressants? It's just so crazy. There are newer types of the drugs coming out, and you have to remember there's something called off labeling. So if a drug was tested for an adult and it's been okay by the FDA, going back to knowing that the FDA, once they give that approval, allows the physician to off label to experiment on children and so forth. Eli Lilly Prozac product was so popular from 2004 to 2023. It's one of the number one drugs, Prozac, using on children. They say it's safe for children from 7 to 17. I've seen studies and read papers where they're actually using these stimulants, antidepressants on children as young as age 3, 4, and 5. The problem with this is that it's used to treat manic depressive disorder and so forth, but also with it, it's being one of the top sellers for depression. And in the last couple of decades, last 10 to 15 years, pardon me, it's a $2 billion industry, an annual industry on the drugs. In the area of the psychopharmacological drugs and pediatric subcommittees, basically what they're realizing is that they're creating a more avenue. Their approach is not to give less drugs, but they think that more children should be on these chemicals. So whether it's Prozac, Zoloft, Paxil, these are all the ones with the advisory board that they're thinking, okay, let's get these new warnings out for these children. Wellbutrin sometimes is used as a weight loss drug and so forth. And with all this public health advisory, one of the things that people need to know is that many even contribute to suicide. And so this is a very sad thing. There's a book that was written out by, again, one of my friends, Paul Bregan. He's an MD psychiatrist here, and it's called The Medication Madness, the Role of Psychiatric Drugs for Violence, Suicide, and Crime. Again, not an easy read, but it really makes you realize that this combination is what we call a lethal weapon in the hands of these children. Some of the side effects, if these children are on antidepressants, anxiety, agitation, insomnia, and panic attacks, they get irritability, hostility, and over impulsive. So imagine if we're treating you for a problem, but now we're creating irritability or hostility. So now that's another behavioral problem that's not being treated. So again, we suppress it maybe with another drug. Mania, hypomania, children being restless. Again, remember these children from age 7 on up can be prescribed these medications. The sad things about antidepressants, the way that it's been by design is that it has a chemical outcome of using meth, cocaine, or PCP. It's identical. So it basically wires the brain for this inconsistency, and it creates violence and aggression. And that doesn't fit in. And a lot of these children, by the way, who have been school violence and all the rest are all tied into, a lot of them were on Ritalin for ADHD, antidepressants are all tied into the same family and so forth. One of the things that we need to know is that these drugs here are really, it's difficult to get on, they're difficult to get off, and even getting off are massive side effects to these kids. Also, antidepressants in the adult world as well as in the teen world, they're using the antidepressants to weight loss, suppress. And so, depending on what's the complexity of what's going on, maybe in the families and so forth, a medical doctor or pediatrician might actually put a child on an antidepressant for weight loss program. This is my guy, Peter Bregan. What I really love about him, he's a psychiatrist. He's a gentleman, he was the watchdog in his own profession about how we were hurting and killing adults and then in the pediatric arena. And so he's written numerous books, but anywhere that you could get any of the Bregan's books, I would encourage you to do that. He realizes, look, we have to acknowledge there is suppression and there's a profound maybe loss of hopelessness. But he says, look, the answer is, and I love it, psychotherapeutic, educational, and spiritual or religious interventions, that we could do more if we had an ongoing conversation with these young people versus the uses of drugs. Other book places to go is Bregan.com, Fight for Kids, ICPA4Kids.org. Here are some of his books. The Ritalin fact book, Talking Back to Ritalin, Brain Disability, Treatments in Psychiatry, Prozac, and so forth. So he's prolific. He's written a ton of books. Doesn't mean you have to have all of them, but it just, for those of you who have a lending library in your reception room, I think a few of these books out here would be very powerful to let an MD do the talking. And what is all this going on with ADHD and the conspiracy? There's a lot of misinformation out there. And part of that goes to that decades ago, about in the 1980s, they realized we have to normalize this thing called ADHD. And if we make it nice chapter association, national association, and not only was it in the pediatric population, but they realize now a lot of adults are being diagnosed with that. The more we normalize it, the easier it is to on-ramp these kids and these adults taking medication to treat it, rather than trying to find behavioral changes that they could do, activities or change of diet. So already in the 1990s, we have a little under 1 million kids that were on Ritalin, and now we're 4 to 6 million. And the number one abuser of Ritalin is North America, specifically the United States. If you go to Europe, nobody uses Ritalin. They change activity, they change diet, but they don't medicate in many countries because they know it's not safe. So the majority, 90%, is given here in the United States. And it's a moneymaker. And what happens is a lot of the drug industry, what they've done is funded some of their quote nonprofits, doctors, and by stimulating the motivation of getting these chapters to get started, to help normalize it, make it more mainstream. And the National Institute of Mental Health, basically, this organization said that 4 to 5 million users of Ritalin doesn't have to be taking it all. So that the majority of kids don't really need to have it, even though they might be on it. Dr. Nora Volga, she is a very interesting researcher, and she did a research on what happens if you used Ritalin. And based off of her research and her paper, she basically said if you use Ritalin in the pediatric population, it's no different. It's potent, like using cocaine to the brain. That you're actually going to get them addicted to have that kind of a high. And so what it does is the receptors get the stimulant of the Ritalin, so it's like a cocaine high. And so what happens, and then it changes a child's learning behavior. And then what does it take the stimulant at the high level? If somebody's taking Ritalin, there's an increased heartbeat, high blood pressure, heart attack could be related to it. If we're talking the nervous system, this is short term depression, convulsions, hallucinations, and altered mental status. It's central nervous system, short term, again, irritation, hostility, and happiness, tics, obsessive compulsive behavior could be tied in the use of, they didn't have the problem beforehand, but the use of Ritalin changes our behavior. Other short term effects, eating disorders, vomiting, blurred vision, dizziness, and so forth. What happens also if we do the short-term effect, what about if you rebound or you start withdrawing from it? It makes, of course, the symptoms worse. There's evening crashes. So it has to be, so if somebody's going to come off of it, it has to be safely done, very slow and very steady. And this should be done with, again, using the medical community, because as a chiropractor, we know we don't put kids or adults on drugs. We don't take them off of drugs, but it has to be done very safely. One of the things that is really sad about the use of Ritalin, the long-term effect, is that it short circuits the reward system of the brain, where when you're a kid and you worked really hard to accomplish a good paper or a test or run that lap and you won or whatever you did, you worked hard towards, and then then you had that natural high that was being released. When a child is using Ritalin as a child or a teenager, what we do is we damage the circuit there. And so they're going to always be looking for a shortcut to stimulate their brain this way. And we're talking, it changes reward, stimuli, and it increases negative responses, and it can create really severe situations. Also very interesting, but hard to find, but I did find this information. If the military, particularly certain military components, if they know that you, as a child, you were on Ritalin for periods of time, there is, and after the age of 12, you're not going to be eligible for many areas of service in the military and so forth, because they know that you've been wired up here a little bit different. And so that child is not going to be maybe a safe candidate for certain parts of service in the military itself. There's also a long-term effect of the fact that many children who have died of Ritalin, it's been underreported, and it's a known fact. We just don't have a great a tracking system, but there's a lot of deaths linked to children misuse of Ritalin. And then also a lot of times what has happened because of the underreporting, either the child took too much, caregivers gave too much, and so again, early death of children related to that. There was one study, and they talked about also the kids, particularly between ages of 6 or 9, the chances of them being overdosed because of primarily caregivers not realizing that they dosed them then and they gave them a second or a third dose, which is really sad. And then again, just too much excess because of the caregiver side of stuff. A lot of times, Ritalin is provided at the school campus, meaning the school nurses have it to distribute to the children, but most of it, the kid receives the medication in the morning hours. I know of parents, because I just recently, in the last year and a half, it's been very difficult to get Ritalin as a drug. And so what they're doing is stockpiling it for their kids. Or they've been going to other states to try to get the Ritalin for their kids. Or what they do is they're trying to spread out the Ritalin in the school week and then take them off on the weekends so they have enough. So it's really strange when there's been now a shortage of Ritalin and so forth, what people are doing to scramble to try to find it and so forth. There was a Harvard study docs that was done, and basically it was a neuropsychology, a post-grad department, and what they did is they took 20 kids, which really isn't enough. So they took 20 kids, and they treated them with Ritalin, and they took 20 kids, and they actually gave them, just changed their nutrition, gave them supplements and so forth. And in this very small study, they found out it was about identical. If you give kids Ritalin, they got their changes. But if you change diet, support, nutrition, all the rest, you would actually have an equal, which makes us imagine if they would have thrown in chiropractic at that time. That would have been fabulous, because those kids would have had, with nutrition and supplementation, would have been doing a lot better. And look at all the things. This is like the American diet: heavy metal, low protein, high carbohydrates. They have thyroid disorders because of their diet and their stressors, all the rest, and all the food additives and the allergies are related to it as well. And again, one of the things that they discovered over at Harvard, mineral imbalances, essential fatty acid deficiencies, vitamin B deficiency. So imagine if these children were out of balance, if we just through supplements, cleaner diets, and again, the power of a chiropractic adjustment, how many of these kids could we help them balance out for their lives? And so again, really high recommendation. We just need to start educating our moms and dads that maybe there's an alternative way or parallel way, if maybe if we could help them through adjusting and cleaner diets, that the kids may not have to take as high a dose as they have. One of the things also as a chiropractor that we have to look at is a tie-in as you and I with the kids with depression and ADHD. How can chiropractic help? And it's really simple. We have to be positive to parents and let them know, you know what, we can't cure things. That's not what chiropractic is, a cure, but we're here to improve what a child's quality of life, the family's quality of life, a classroom quality of life. And then we could be a practice of hope for many families, bringing them in. And it's really simple. I want to encourage you, you family wellness chiropractors are watching me here today. You're a resource teller. Don't give up. So find books and get papers and have encouraging talks in your adjusting room to encourage these parents. Because number one, it's the chiropractor. We're the ones we have to tell them that they're over drugging our children. As you've looked at different drugging of children, my parts from 1 to 4 here, it's too easy over the counter. It's too easy being prescribed. Parents don't have time to have sick kids. And this is why, as a chiropractor, our answer is we care about your lifestyle. We care about how your children are growing up, and we could be the wellness movement within our own community and all the rest. And it's all about improving what? The improving body function through the nervous system and how important that is, and how you as a family wellness chiropractor, particularly if you're seeing a family twice a month, once a month, weekly, whatever your schedule is, you could be the positive encouragement to get them in the right direction. And look, as chiropractors, we're not anti-drug. We just say, let's change the lifestyle like they do in Europe. And if you go to second or third world countries, they have their problems, trust me, with malnutrition, all the rest, but they don't have anxiety or they don't have depression, they don't have ADHD and all these other issues because of the fact that they live a simpler life, they have less stress, they don't have technology, they're eating a lot simpler and so forth. And one of the most important things that you, as my fellow colleague, have, you're number one, we teach from the inside out. We're not the outside in, we're the inside out professional. And we can just give them just other choices that come talk to me. What are your concerns? And we can look up things and share that information to them. And look, we're the alternative choice. And if they could just get to us and just know that we could help them out, docs, that would be the thing that we're looking for, to be the positive thing to offer friends and family members and so forth. And invite them to come into practice and have just a consult with you. If somebody's not sure, just invite them, because the thing is that a lot of times they think, well, if I can get a drug over the counter, if it can be prescribed, isn't it safe? And as you saw me going through this series, there's no safe about this. And so we would just really encourage you just to start chatting with individuals. We just could slow down the amount of chemicals kids are being exposed to and let them grow up with their bodies without the interference, how much healthier our society would be. And that's why, again, we always think that there are 5 steps to healthier thinking. And I'm just going to bring them through. Number one, practice the lifestyle. Who better to teach that than you, the family wellness chiropractor? Number two, be involved. You have to encourage moms and dads to be really super involved. Ask more questions. Get involved more with the decision. Don't just accept, I was told to do that. Ask a question and find if there's something non-invasive more that they could do. Also, too, you have to build a wellness team and tell them, look, it could be find a practitioner who's more of a wait and watch, maybe referring them to a naturopath over a pediatrician that was really heavy on drugs, a wellness-minded pediatrician, or involving others like somebody who does homeopathy, your chiropractor, and all the rest. And then one of the most important things is wait and watch. Before you make any decision, just tell the doctor, we're going to wait a little bit. We'd like to come back and ask some more questions. But if you race off already making a decision when you were just discussed with that for 5, 10, or 15 minutes, it might be one of the worst decisions that family or that child is going to be exposed to. And always remember, more and more the studies are showing the drugs are not safe in the pediatric arena. And the problem is that drugs are going up with children, they're not going down. And so, one of the things we want to encourage you, docs, is again, just know that knowledge and caring and loving and educating is it. And who better than the family wellness chiropractor? Again, if you don't have the third edition textbook, I would encourage you to do that. Would also encourage you, make sure you go to my website, drclaudiaonrig.com. See my seminars, First Adjustment, where I teach in the spring or fall of each year and so forth. I look forward to meeting you soon. Take care, everybody.
Today's pediatric show, Look to the Children, was brought to you by ChiroSecure.